Yeah, absolutely. So we know that pain is a really common experience during pregnancy. And one of the ways that we can try to manage that pain is with prescribed opioid medications. But when, doctors and their pregnant patients are trying to sort of weigh the risks and benefits of use of these medications during this time, there are a lot of different things that they have to consider. Of course, pain management for the patient is really important. But we also know that these medications do cross the placenta, and there have been some studies that have observed these sort of increased risks for neurodevelopmental disorders in exposed children. For example, in this study, we looked at autism spectrum disorder and attention deficit hyperactivity disorder, or ADHD. Again, these previous studies have sort of observed increased risks for these disorders with prenatal exposure, especially as sort of amount of exposure has increased. But we know that given that we're often using observational data to try to answer these questions, there are a lot of different things that can confound or add bias to our associations. So in our study, we tried to do a number of different things to try to address potential sources of bias. And we ended up finding that when we used sort of our strongest tests, our designs that accounted for, we felt like the most important potential sources of confounding, we really found that there was not a substantial increased risk for these disorders in our results, at least in the population that we had. So I think that, we are able to provide some more information um, about a sort of specific set of outcomes. So, there have been these studies that have implicated these medications and exposure to them during pregnancy with increased risk for neurodevelopmental disorders broadly, or specifically, autism or ADHD. So we're able to provide maybe some more reassurance that we're not seeing, substantial increased risks, at least with like judicious opioid prescribing. So we're not able to, you know, speak on really high amounts of exposure, given that that wasn't really observed in the study that we had from Sweden. Um, so it would be also important to, consider whether or not higher doses might be something that needs to be explored further. And again, we're only really able to comment on this set of outcomes, autism and ADHD, whereas there are a number of other potential outcomes and risks that would need to be considered. For example, there have been some studies that have found increased risk for adverse birth outcomes like preterm birth with prenatal opioid exposure. So that's still sort of an open research question. But when it comes to concerns about risks for neurodevelopment, hopefully this study can provide a bit more reassurance there. Yeah. So I think what we were able to sort of comment on here is that at least with sort of typical levels of prescribing at sort of low to moderate doses, we're really seeing that we think, maybe despite initially observing some increased risks, when we account for all sorts of background factors that, might lead up to someone being prescribed an opioid or, might also be a risk factor for the outcome, when we're able to account for a lot of those potential confounding sources, including, unmeasured genetic and environmental confounding, we're really seeing those risks go way down. So that's not providing a lot of support for a causal effect of the medication on these outcomes. Of course, there's no study is perfect, more needs to be done, but we really used a number of different ways and a number of different measures of exposure to try to account for some uncertainty there, and really across all of these different designs that we used and all of these different indices of exposure, we were really seeing converging results. So I think that that is something to sort of keep in mind. Again, not commenting on really really high heavy amounts of use throughout all of pregnancy. That's not what we were observing in our population, which was from Sweden. But with judicious prescribing, I think we can provide potentially some reassurance there that we're not seeing large increased risks for these disorders. And again, I would sort of reiterate that it's going to be really important to consider, making sure that the pregnant person has adequate pain management, because that's going to be something that's so important, not only for the pregnant person's functioning, but also for having a healthy child. So thinking about the reasons for needing pain management in the first place and how important it might be to be treating that, weighing that just as much as concerns about, impacts on the child. So I think, it's difficult to sort of make, um, broad statements about what is going to be best for any individual patient in a given time. So I think that I would hope that, uh, in conversation with, their physician or their prescriber, that this could be something that is discussed, like, hey, there's some data showing that there's not, a big increased risk for neurodevelopment, but it would be important to think about other potential concerns, other options for pain management. Of course, there are other types of medications. There are non-pharmacological ways of addressing pain. So I would think that all of those things would be important on sort of an individualized basis to discuss between the patient and their physician. I would say, this is certainly a topic that a lot of people are interested in, and understandably so. There's a lot of different, potential risks and benefits that, pregnant patients and prescribers are trying to weigh at any given time. And I think a lot of these are still questions that could benefit from additional research. So, for example, our study was done with a population in Sweden, so it would be important to try to replicate these findings sort of outside that medical and social context. See, do we see these same, sort of patterns of results in a different sample? And again, really sort of getting a good understanding of, does this pattern that we observed does that replicate when we're talking about higher amounts of exposure or higher doses? Because there will be individuals with, maybe chronic pain or chronic conditions that would be getting higher amounts of medication. So it would be helpful and important to study that further.